Welcome to my channel. My name is Miriam, Nurse and Nurse Practitioner. Today we're going to talk about 10 nursing interview questions that you may come across whether you are a nurse or you are a nurse practitioner, okay? So the first question will be, tell me about yourself, okay? So what kind of answers do you think they're expecting? Well, I could say I'm a compassionate, dedicated nurse of how many years, and I enjoy taking care of people. I'm a great team player, and you can go on and on about that, right? Another question they could ask you at an interview for a nursing position or nurse practitioner is, why did you choose nursing as a career? Okay, so it's good to me. There's no need to lie, but of course the one answer you don't want to give is, I joined it because that's the only profession I could get a job easily. Because you could see that there are some people moving into nursing because they feel like this is the only profession that you could get a job, So that shouldn't be your first reason for becoming a nurse, right? So why did you choose this career? I chose nursing because of my desire to do make a difference in people's lives, get people at the most vulnerable time. So it gives me the opportunity to support people, take care of people. So I enjoy doing that. So of all careers, that's why I chose to be a nurse or a nurse practitioner. How do you handle stressful situations in the workplace? Okay, so you want to be careful with that question because you don't want to say, that's why I quit my last job, right? You don't want to tell anybody that in an interview. But you could say, I prioritize my work. I do make sure if I need to delegate stuff, I do that so that I can concentrate and make sure that I'm doing what I need to do. I also utilize some stress management skills, deep breathing, maintain a good work-life balance so that I'm able to handle stress as they can. Because you want to be as truthful, but then as professional as you can be. You don't want to be just saying things. How do you ensure patient safety and quality care? I practice based on, established evidence-based practice. I'm vigilant about monitoring my patients. I also prioritize great communication as a nurse practitioner too. If a patient is not, it's above my pay grade, or if a patient is really above my skills, so I make sure I collaborate with other providers, other professionals, because people, you don't know everything. So you always make sure that you are able to prioritize, to consult other people when the time comes. Describe a challenging patient care situation you encountered and how you handled it. So you go and tell about a situation where a patient was, angry because they came to see you and they were, they have waited 3 hours in the waiting room and Of course, you want to first apologize and then listen to the situation, put yourself in their situation. And that's how come you were able to, when they saw the empathy from you, and they saw that really you have nothing to do with it, then, the patient was relaxed. And of course, you also notify the clinic manager to take care of, the situation to prevent that from happening. So you listen to their concern, because a lot of times people are upset and the anger gets higher and higher because we don't validate it. You want to validate. Anytime someone comes to see me, even as a nurse practitioner now in the room, and they start complaining about how they waited a long time, the first thing is, I appreciate your time. I really apologize for that. We make sure we get management, involved so that they can take it from there. But I'm glad that you waited, and here we are, and then you go from there. But you don't want to just brush it. I have situations where you go to the room to see somebody and you've been waiting. Maybe they didn't know, but they don't even acknowledge the fact that you've been waiting. So you want to be very mindful of that. So then the other question that I ask you at an interview is, how do you stay up to date on the current advancements and developmental technologies in your field? Then you can go on to tell them that's where you are so much into making sure you attend seminars, conferences. You are very up to date on your medical conferences. The other thing too is that, you also use standard, up-to-date, evidence-based practices in your practice. You don't just want to say, okay, yeah, they used to do this, let me apply this here. No, because the goal is that they want us to provide standardized care for all patients, right? If a patient comes to see me with, chest pain, I should use the same standard that I'm using. The same patient goes to, up north somewhere and they're seeing a nurse practitioner there, the nurse practitioner should be able to use the same standard, right, to take care of that patient. So that's why they want to make sure that we're up to date. So we need to make sure that we know how to answer those questions. Another question that the employer might ask a nurse practitioner during the exam is, how do you handle conflicts or disagreements with colleagues? Okay? So you could say, yeah, I believe in open, communication. You show respect for others because we are all professionals. So you don't want to jump off the gun when somebody has a disagreement, And there are times where, like a nurse practitioner, you are working in the clinic. Your rooms are full already with patients. It's getting close to the time. And the clinic manager is asking the front people to add another patient on your schedule. That would be a time where, we need to discuss this. Because mind you, the clinic managers in primary care, majority of them are not nurses, are not in nursing. They have no idea what you do as a nurse practitioner, to be frank. So that would be a good time to say, okay, wait, I need to talk to the manager. We need to discuss this. Do you know that I have this patient here that needs some blood work, that we need some e-clinic blood work that we need to check, and then after that I need to do the result. Do you know that this patient in this room here, the blood pressure is so high, we're giving them something, we're going to recheck. Do you know that this one here, blood sugar is very high, we give them insulin, we have to, wait and then recheck and do this and do that for them. So when you explain things that way, people understand it better. So anytime that there's a disagreement, there's no need to jump into conclusion or get angry. Just make sure that maybe sometimes the person does not really get what is going on. So you just need to explain it and they'll be fine. If they're not fine, then, of course you take it there. But to me, you want to just explain something so that the situations don't escalate, Describe a situation where you had an emotional support to a patient or their family. There are times where, especially, you meet patients that have either they or their family, are in a condition that is critical, or they have a terminal illness, or they have a diagnosis that is really getting them very upset. So you just sit there to listen, right? You are there to listen, you talk to them. And there are places where you even have social workers, counselors. There might be situations where you even have to bring social workers in there, so that they could talk to help the situation. But the active listening is very important, and providing the emotional support, is very important. You don't want, because you have situations where patients have complained about providers because they feel like the provider wasn't caring. That might not be true, but because the way we came across, or the way you are not listening, could make them think that, they are talking to you and you are tapping, doing this, doing that. There's never a time that you stop and just look them in the face and talk to them. So those little things like that mean a lot, because they could, to them, okay, yes, so what's going on? So this, they're talking about their problem, but we are only doing this. So it could be construed that we are not, we are not caring, So you just want to make sure that you pay attention to that. And then, how do you ensure effective communication with patients who have limited English? Okay, anywhere that you are working now, they have translators, or they have companies that contracted with companies that have translators. In almost every language you can think of. At Majo, they have this translation where they have the little computer and the interpreter. The translator is on the screen. Oh, I love it. I love it. So, yes, we'll make sure I use translators, because anytime I meet a patient and we're talking and they say, oh, they need a translator, immediately you get one. A lot of times, even the medical assistant will catch that before you do. So you bring the translator in, because the key thing is you want to make sure that patients are getting all the information, because that will help with compliance, right? That will also help with the quality of care. That will also help them to feel comfortable coming for care in your organization. So it's important that if someone has limited English, if possible, we get someone to interpret the information for them. Very important, because again, that will also help with compliance, and that will also help with return appointments, returning back to clinic for more care. Okay, so this is just some of the interview questions that you may encounter. There are more, but these are some of them. Some of them might be geared towards, okay, so this patient came in with high blood pressure, and this is their first time, and they're African American. What is the best medication to start for them? So anywhere you are going for an interview, you need to study that organization, research, have an idea the type of patients they see, things like that, so that you'll be able to answer some of these medical questions. Because some people have been to interviews that they have medical questions asked. To me, a lot of times I always get these emotional questions, or how do you handle this, or how do you handle that? But once in a while, yes, I could get a medical question. So you just want to be prepared, and you want to show that yes, you genuinely care about what you are doing. You can't go in there and start acting up or start bragging and lying. You can't go into an interview and start telling stories about the former employers, because mind you, these people are also kind of listening to you to see are you going to be a good fit for them. Anyhow, thank you so much for listening to my long speech, and come back again, subscribe, and we'll see you in the next video. Oh, and by the way, practice gratitude. Very important to practice gratitude every day. Okay, have a great day. Bye.